Welcome to an INNCO update. I'm Dr. Charles Gardner. I'm the Executive Director of INNCO. And INNCO is a nonprofit organization that supports the rights of 112 million people around the world who use safer forms of nicotine to avoid toxic forms of nicotine. And we are 37 member organizations. We're an alliance of organizations and affiliates all over the world. One of the issues that we're watching with keen interest is the changing opinion of experts in the field of tobacco control. I think the public is not really aware of this, but it's very clear to me. I'm a developmental neurobiologist. I've worked in global health for 30 years, and I've only been in this field of tobacco control for 4 years, but I've seen expert opinion beginning to shift, and there's a legitimate debate in the field between people who support harm reduction and those who are, let's say, much more cautious about novel, safer nicotine products. And so what I've seen, and we as a community of ex-smokers, which is us, have seen, is the experts who were really on the side of caution have shifted to the fence. And those who were on the fence have shifted toward being proponents of harm reduction. And those who are on the side of harm reduction and have always been are actually getting a bit more vocal in their communications. So we want to present to you one expert who I would say is still sitting on the fence, but we'll let you decide that yourself. This is Dr. Wasim Zahid, who's an author, a cardiologist based in Oslo, Norway. He works in the main hospital, Drammen, Norway, but he is well known as a commentator throughout Scandinavia, and he stars in a popular NRK TV network program called What Seems to Be the Trouble. I'm going to let him speak. The thing I want to say is INNCO doesn't endorse everything he says, but I think it's very important that you understand this is what an expert who's looking at all the evidence says today. Thank you.
Hi, my name is Dr. Wasim Zahid, and I'm a specialist in internal medicine and cardiology. That means that I spend most of my days treating and preventing serious diseases like cardiovascular disease, heart failure, chronic obstructive pulmonary disease, and cancer, to name but a few. One of the leading causes behind all of these diseases is tobacco smoking, cigarettes. Therefore, I do whatever I can to encourage my patients to stop smoking. Some patients take my advice promptly and are able to quit smoking immediately without any help or aid, and that is great. But not all patients are as fortunate. Luckily, we have several aids that can help you stop smoking. There are nicotine products like chewing gum or skin patches, and there are also effective drugs that may help. In my opinion, e-cigarettes or vaping can also act as an important smoking cessation aid. And for many patients, these products have been essential for quitting smoking. By replacing normal tobacco cigarettes with e-cigarettes, patients have avoided many of the dangerous and detrimental health effects of tobacco. In my understanding, e-cigarettes have probably improved the health of many patients, prevented serious cardiovascular and pulmonary disease, and perhaps even saved some lives. But with the rise of vaping and the increasing popularity of e-cigarettes, there have also been a lot of concerns regarding the safety of these products and whether they may have harmful adverse effects. After all, when you are vaping, you are inhaling different chemicals which may indeed harm your lungs or your body. Could e-cigarettes cause heart disease or even cancer? And if the risk of doing so is substantial, could it even offset the benefits of using e-cigarettes? These questions are important and understandably a cause of deep concern for many e-cigarette users. So, in an attempt to settle the disputes and sort out some of the controversies surrounding e-cigarettes, The Norwegian Institute of Public Health recently released an extensive report looking more closely at the potential adverse effects of vaping. Now, before we dive into the results of the report, it is important to clarify some issues. Firstly, when looking at the harms or dangers from a certain product, it is important that we do so in comparison to the alternative. In this case, that means that if there are harmful effects of e-cigarettes, we have to compare them to harmful effects of normal tobacco cigarettes. This is important to remember. Secondly, it must be outlined that e-cigarettes are not a uniform product. They come in many different shapes and versions. Some contain nicotine, others don't. There are different tastes, flavors and aromas in them. Different sizes, they may contain different ingredients. Furthermore, the judicial regulation of sales, marketing, what is allowed to be used in e-cigarettes also varies between countries. So, an e-cigarette is not always an e-cigarette. Anyway, let's now dive deeper into the report from the Norwegian Institute for Public Health. What the Institute did was to gather information from 33 systematic reviews of the health effects of e-cigarettes. They looked specifically on the effect on lungs, the cardiovascular system, mental health, the risk of cancer, and the effect on pregnant women. Now, the report did show that e-cigarettes could cause local irritation in the airways, increased coughing, and worsening asthma. But is it worse than normal cigarettes? We'll get back to that. Another cause for concern is the potential adverse effect on cardiovascular health. E-cigarettes with nicotine have the ability to activate the sympathetic nervous system, leading to increased heart rate and blood pressure. So one could opine that if your blood pressure is raised several times a day because you are vaping, that could over time lead to the development of heart disease. With regards to mental health, there is already a well-established link between nicotine products and issues like depression and anxiety. However, the causation is less clear. Is it the nicotine causing mental problems, or is it rather that people with mental issues tend to seek relief in nicotine products? Probably the latter. On the other hand, there is research suggesting that nicotine is detrimental to the developing brain, and therefore young people should certainly not use nicotine, neither in normal nor in e-cigarettes. And the same goes for pregnant women. We know with certainty that nicotine has a very negative effect on the placenta, fetal development, and the fetus. So pregnant women should most definitely not use any forms of nicotine products, and probably not nicotine-free e-cigarettes either. With regards to cancer, there is still not enough research on e-cigarettes to make any sound conclusions. There are some animal studies that imply that increased risk for cancer, but human studies are still lacking, so we don't know for certain. With normal tobacco cigarettes, we know for certain that they cause cancer. Okay, so what are the conclusions and what advice do I give to my patients? First of all, there is still quite a lot of uncertainty when it comes to detrimental health effects of e-cigarettes. We know more now than previously, but we still don't know enough. The reason for that is that we still don't have enough long-term studies. So we actually don't know for certain about the long-term effects of smoking e-cigarettes. Still, there are some indications that e-cigarettes might have some negative health effects. But, and it's a big but, as I stated earlier, we cannot look at the risks from vaping in isolation. We have to compare it to the risk from the alternative, which in this case is tobacco smoking. And while we don't know enough about the effects of e-cigarettes, we know a ton about the negative effects of tobacco smoking. Tobacco cigarettes dramatically increase the risk of cardiovascular disease, heart attacks, heart failure, stroke, pulmonary disease, and cancer. They reduce the quality of life, are detrimental to health in a number of different ways, and make you live shorter. Tobacco cigarettes are a cause of increased spending in health budgets, money that could be used for many other better purposes. So when people replace normal cigarettes with e-cigarettes, I'm convinced that they are dramatically improving their health, because they are removing something very harmful, tobacco and replacing it with something that is probably much less harmful, e-cigarettes. And this is also my message to my patients, because what I want from them is to stop smoking tobacco. And if the use of e-cigarettes, preferably for a short period, can help them quit smoking, I welcome the use of e-cigarettes. If people can stop smoking without any aid, that is great. But we know that it is very difficult to stop smoking tobacco, and many patients unfortunately fail to do so. So if e-cigarettes can help them achieve this, I'll be happy for them and I'll support them in that. However, we also know that there are some people who did not smoke tobacco previously and were not trying to stop smoking tobacco but still start smoking e-cigarettes just for the fun of it. And that, as a doctor, I do not encourage. I see no benefit of smoking e-cigarette if it's not for the purpose of preventing tobacco cigarettes.